Kenya is an early-stage social enterprise incubator that supports innovative businesses in the healthcare and life service sector through funding, mentoring, and providing networks.
We've supported over 10 companies so far, not just in Kenya. We also have a few outside of Kenya. Currently, our portfolio is about 8 companies.
Among several health innovations that Villgro supports is Afya Poa, which provides an affordable and accessible insurance health solution that meets the needs of the poor and underinsured.
Villgro stepped in a big way. They provided a lot of advice and help for us to figure out our market strategy. More to that, they also put some money into the project. Afya Poa is a comprehensive health financing product that comprises 3 benefits. So there's an insurance benefit, which is actually the main benefit of the product. Then we also offer various savings accounts and loans on the same product.
Mambo ya Afya Poa nilijua tunakuanga na kipindi ya wamama. Tukaambiwa ukilipa unalipa 4750 for 1 year, na tena si lazima ulipe yote pamoja. Unalipa 3 installments.
Mimi ni msonaji, nasona manguo za ladies. Nilijua Afya Poa through chama yetu. Tuliamua as a Sunbird Women Group tukakata insurance nao. Mtoto alikuwa mgonjwa, nikampeleka Lang'ata Hospital, akapimwa akapatikana akawa na malaria na pneumonia. Kwa hivyo alitibiwa akapona. Bili ilikuja 58,000 wakanilipia.
Nimefaidika na Afya Poa kwa sababu kujifungua nilijifungulia Uhai Neema Hospital na Afya Poa ikakiria bili yote, na nilishukuru sana kwa sababu pia inaendelea kunilipia mpaka mtoto afikishe 9 months. Sindano zote ninaenda bure. So ninasema Afya Poa ni product nzuri sana. Wenye hawajajiandikisha, wenye hawajajua umuhimu wa Afya Poa ni nini, ninawaomba waweze kujiunga na Afya Poa.
As a means of reaching out to a wider population with its health insurance package, Afya Poa targets groups of informal sectors. Marimba Investment Sacco in the transport industry is one such group.
Afya Poa imetusaidia, mimi na wenzangu imetusaidia kwa afya, ambapo mtu ukigonjeka wanakushughulikia, wanakulipia, na wewe unalipa kidogo kidogo.
Out of pocket costs of accessing healthcare are really a huge enemy. We typically only go to the hospital when we are really sick, partly because we can't afford to be sick. You know, when I'm sick and it's that time of the month, I'm thinking to myself, how do I survive? How do I keep going until I can actually afford to go to the hospital? And that's how something that could have been treated with maybe 100 shillings worth of antibiotics becomes something that we have been admitted for. And now it's about surgery, expensive outcomes that can be nipped in the bud through primary health care.
The reason why we decided to partner with Afya Poa is Lang'ata Hospital is it's affordable, accessible, and it's flexible. It covers inpatient services up to 30,000, dental up to 30, ophthalmology up to 30,000. The same applies to maternal services, both inpatient, either by cesarean section or by normal delivery. It also covers for immunization, covers for 2 ultrasound, and also covers for antenatal visits.
Since we partnered with Afya Poa, we treated approximately 50 cases, and these 50 cases are new cases which we never had them before. They are new patients, and we've had people from who come here for the maternity services, for the MCH clinics, and we also even have dental clinics who come and they are subbed under Afya Poa.
the ultimate impact that we have to, or we want to have as a company, is to make affordable and quality medical care available to everyone, whether you are rich or poor, whether you are educated or not.
Another unique solution supported by Villgro Kenya is Health eNet, a Kenyan digital mobile teleconsultations platform that allows every primary care clinician in the country to remotely consult a specialist who could be based anywhere, hence providing specialist skills not available in remote locations.
I met Villgro and the CEO of Villgro, Dr. Robert Karanja, here at Strathmore. And when I explained to him what we were doing, he said this is an ideal type of enterprise that Villgro wanted to support. And so that's when the idea for Health eNet and the Gabriel teleconsultations platform was born, to try and make it easy for cases in countries like in India and Kenya, where there's a big shortage of doctors, and we can now give nurses in these remote parts access to specialists who can help them manage the case locally.
The way I've worked with Health eNet, I've worked both as a consultant, so I'll provide guidance to my junior colleagues, the nurses and the clinical officers. At the same time, I've worked as someone who is seeking for a second opinion from my senior colleagues. The first case that I ever posted on the Health eNet was about this Turkana girl. She was about 6 years old, from northern Turkana. She had a liver disease, and we had done almost all we could in our facility, and we could not reach a point. We could not make a diagnosis of what was going on with her. So I posted her case on the Health eNet platform, and then we got in touch with the pediatrician. Her name is Edith Mwasi. She's from Kwale. So it was really helpful because she was able to open our minds, and she made us think wider than we were, and we were able to help that girl.
One of my classmates picked out that I'm particularly interested in child health, and she worked with eNet at the time, and therefore she asked me whether I would be able to assist in doing remote consults, and I was very much excited about it. I just felt like this would be an opportunity not only to increase my knowledge in the field, because currently I mainly deal with newborns, but also to use the knowledge I've acquired to help those who cannot be able to access, expert opinion or just advice, or even a referral system that makes their medical care much easier.
There is nothing that beats the satisfaction of seeing someone get well that you've helped. In life, really, money is not the primary thing. Money helps us do things around, but when you see a parent who couldn't go to work and was almost losing their job, get back and they're doing well, that in and of itself is a fantastic thing. And the second thing is that there's something we call the health premium, where a community gets well and the people are well and they're able to work and produce. That's a greater reward in practicing medicine, and that's what makes me want to do community work.
On the Health eNet app, there are several features, and one of the most important features is the ability to post pictures. And when you're doing remote consultation, history alone might not be enough, because you need to see what is it that people are talking about. So the pictures help you to make a diagnosis.
The great thing about this app is the team that goes out to look at the patients and consult has been very fantastic in how they get the information. One, they go down to the social environment of the patient, which actually in healthcare determines about 40% of health, not just the treatment. And the second thing is they do get the full history, the social history. They get the medical history, and they're able to load for us pictures of the patient, the area that is injured, how it is looking currently. Probably if they had the older pictures, they show us the old ones. And then for orthopedics, imaging pictures are very, very critical in making the accurate diagnosis. And they have a place in the app where I can quickly and easily get those images and the reports that have been done by the radiologist, and I can make almost diagnosis 95% of the time with very good confidence. And if the information is not there, I'll write back and say I need this extra information, and in less than 24 hours I tend to get that information and I can make a good diagnosis.
Now we are entering a new era of universal health coverage in Kenya, and this means that every patient should have access to opinions or consultation with a doctor or possibly even a specialist. And this is not easy to do. It needs patients to move, it needs the financing, how are you going to pay all these specialists? And this is where technology comes in. So now we can get a patient who is sitting in a remote part of Kenya, but now has access to a medical consultation by a doctor or a specialist.
Villgro Kenya not only supports health enterprises in Kenya, it has also broadened its wings in the East African Community Bloc, one of the health enterprises being Matibabu in Uganda. Developed by a 24-year-old Ugandan software engineer, Matibabu is a device which tests for malaria without drawing blood and recently won the African Prize for the most promising engineering innovation.
We began the work for Matibabu actually 4 years ago because we all had had different episodes of malaria, and we knew that diagnosis for that disease is kind of tricky, takes a long time. We said, let's give this a shot.
Our main aim is to eliminate the pain that goes through being pricked using a needle, and so the same technology can be taken in that direction, especially with those diseases that affect the blood and also the red blood cells specifically.
Health startups are transforming the healthcare sector in Africa, and Villgro Kenya is at the forefront in making sure the toughest health challenges in Africa are solved.
It's also good to observe that it's a journey that you cannot really take alone, and in most cases, some of the challenges that we usually have is we keep asking, where's the money gonna come from? We keep asking, how do I introduce myself to maybe the director at Kenyatta Hospital or the Minister of Health to be able to pitch my idea. But ideally, what we're trying to do and what we're actually doing as Villgro Kenya is to build a platform for those people who have these amazing ideas that can actually transform our health system, to be able to leverage that, to come and work with us and be able to access all of these services that we're able to provide for you. Money, networks, strategic partners that can be able to help you to understand how to move your idea from A to Z. And then let's work with you and make it happen.